So anxiety is a condition characterized by an excess of worries, yes, that people have. They cannot stop worrying about things. Typically, people who suffer from anxiety, they can have, in addition to this excess worrying, they also can have symptoms. Yeah, so there are different forms of anxiety disorders characterized by anxiety. Yes? So there are conditions that come with only worrying all the time, and that impacts as well the capacity of the person to sleep, the capacity of the person to function, to go about doing their daily obligations depending on the severity, have as well muscle tensions, and so that's what, it's one form of anxiety, that you can have a number of different symptoms associated, physical symptoms associated with anxiety. But by far the most common ones are, having tachycardia, palpitations, and having shortness of breath, sometimes this pressure, in the chest. This is very common. It's a symptom that people have when they feel very anxious, is that they have like a sensation that their chest is being oppressed, as if it was a very lot of weight on the chest. And so these are common symptoms that occur from people who are constantly anxious, as well as muscle tension. So that's very common, for instance, tensions here in the neck, or people can have headaches as well because they're so tense and anxious all the time, and so the muscles here, behind the neck, are constantly contracted, and that leads to development of headaches. So there are a number of physical symptoms that people can have as a result of anxiety. So, what can we do if we suffer from an anxiety disorder? So it really depends on the form, the type of anxiety disorder, or the type of anxiety that the person has. Sometimes it's just anxiety that it's not necessarily a disorder yet. So sometimes there's some people who tend to be a bit more anxious, and this is not pathological necessarily. Yes, so this is just normal variation in the way people respond to stressful situations. So as a rule, it becomes a disorder, becomes a medical problem when there's an impact in the capacity of the person to function. Yes? So if there's no impact in the capacity for a person to function, then it just may be a normal, just normal variation. And as I said, some people are more anxious than other people. Yes? Now, if the question is about the normal anxiety, so people who are more anxious and have a hard time dealing with stress, and so then in these cases many times it's more an issue of learning how to control a bit more the emotions and decrease the level of stress. So a lot of this can be done through therapy and through either reconditioning the way the person thinks, or learning how to have better control of the physical reactions to stress.